Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. And I'm here to deliver another lecture of Health Education Lecture Series. And we are passing through the area of chest. And passing through the area of chest, we have described about the organs which are situated in the chest area, and then after that, their sickness, diseases. What are the diseases they can attack or we can recognize in the chest area? Plus, with their sign and symptoms, which we can see outwardly. Only those outwardly signs with the diseases, and we are discussing this. I think it will be a last lecture for us because after that, when I will complete all the systems from head to heel, after that, the detail of the diseases will start. That detail of the diseases will take, even one disease can take the full lecture. So therefore, I'm just giving you the description of the areas, organs, and their diseases. So whatever diseases we will discuss later on in detail. Just like I have given you the description of the lungs, that there are two lungs, their structures, their formations, their height, their weight, and everything I have told you. And then how they are formed, and especially the bronchial tree I have described, which is the main functioning unit, you can say, in the lungs. This bronchial tree is the main functional unit of the lungs. We have already discussed about that one. And the shape of the lungs as well we have described, and the upper boundary and the lower boundary, and the lower bottom, and you can say the base of the lungs, that is up to the diaphragm, and I have described about the diaphragm as well. And the shape, which is a different kind of shape, that's a dome shape of the lungs at the base. So this has been discussed already many times in these lectures. And last lecture was to discuss about the diseases of the lungs. And mostly we have discussed about the asthma, bronchiectasis, bronchitis, and COPD. COPD is a type of chronic disease. It looks like asthma. It looks like asthma because it's also chronic. The chronic inflammation of the lungs, and when the airways are not getting normal air and passing through normal airs, or they are excited by any allergic substances, that's known as asthma. But when there is a chronic type of obstruction in the airway passages, that is because of some diseases, or maybe some flames inside coming into the airways, that blocks the breathing or respiratory areas in the lungs. That is known as COPD. But still, remember, there are temporary obstructions because of some temporary complaints, just like the bronchitis I told you. The bronchitis has obstruction of the air passages, but with mucus filled. And these are inflammatory conditions, and these are temporary, because inflammation has its limited time area. So after that, the inflammation will go with the treatment or with the precautions, or in whatever way the nature cures himself. The same way the bronchitis goes off. But whereas the asthma and COPD are concerned, the asthma is a similar type of chronic condition like the COPD, but asthma is excited by any excited factors, any stimulating factors. Those are known as exciting factors, those are known as maintaining factors. But basically, the maintaining factors are connected to the COPD. When something has happened and it is running for a longer period, when it is running for a longer period, that is known as a COPD. Whereas temporarily, frequently, airways are obstructed due to any exciting factor, This is known as asthma. So this is the between the difference between the two. You can understand that. And about the bronchitis, I told you it's a mucus filled of things. Whereas the COPD is also a mucus filled of things, but it is a type of obstructive and chronic things. Whereas the bronchitis is the acute type of inflammations with the mucus filled bronchial tree. After that, we have discussed about the and you can say the pneumonia. That's also from caused by the pneumococcus, as it is known. The pneumococcus is causing that things, and with which the new bronchial tree is filled with substance that is a type of solid substance, and even it makes difficult for the inspiration to go air inside that. And this is also an inflammatory type of conditions, and it has a limited period. If it is not complicated, automatically it will be cured. But if it's complicated, because it's a very painful condition, difficulty breathings, with rusty mucus, with fevers, all these conditions bound and the person press the persons to take some treatment, to take some type of precautions and medications. But ultimately it is recovered. If it is not complicated, complicated means sometimes the pneumococcs and they are covered, but they are complicated. The condition of the lungs is complicated by the tubercular type of bacillus. And when it is complicated, then it's a linger on process. It takes long time for the cure, and even sometimes not. So in this way, because tuberculosis has a different criteria of its course. So we will discuss it later. But this is what I want to tell you about this pneumonia. Main characteristic symptoms are the rusty mucus, fever 104, difficult breathing, painful breathing, and also motion of the ali nasai. This is known as the ali nasai, the wings of the nose. They normally when we are healthy and we are breathing normally, there is no motion in the nose. But when there is a pneumonia, it has an indications that forcibly you try to use the respiratory organs from nose to downward, and then ultimately there is a motion of the ali nasai. So not only this one, this is another important symptoms of the pneumonia is that there is a abdominal or a tracheoabdominal respiration. About respirations, I have described in my previous lectures that when a child borns, child has the newborn fetus, a newborn child that has a abdominal respiration, because at that time the lungs are not fully expanded and lungs are still in a recovery phase, and that's why the most of the muscles are not competent to continue the breathing. In that at that time the abdominal muscle, which are known as the accessory muscles of the respiration, so abdominal muscles take part, or you can say they support the respirations. And in a newborn children's, you can see that more than the chest, abdomen is moving. In this way, the similar type of condition happens in adults with if they are suffering from pneumonia. So if they are suffering from pneumonia, the chest is not moving that much as the abdomen is moving. So this is known as tracheoabdominal respirations at that times. And so this is the a particular type of indications. The two main important indications that you can see from outside: motion of ali nasai and abdominal respirations, the movement, more movements of the abdomen muscles. So that will indicate that it's a type of pneumonia, plus the rusty mucus, whatever, because nature wants to facilitate the breathing in the lungs, and whatever is coming as a flame or any type of obstruction, you can say, which is removable, nature removes it. So whatever the even interstitial fluid coming up inside the bronchial tree, that is time to time expelled out to facilitate the respiration, to facilitate the oxygen to go inside, and the carbon dioxide and other gases should to come out from the lungs, so that the way should be clear. And there is a swelling, there is a inflammation, pneumonitis, inflammation. So all the signs of the inflammations, the pain, redness, immobility of the organs, and fever, and other signs, outside signs I have told you, the Alina's motions and the abdominal respiration or thoraco-abdominal respiration. These are the outward signs we can see in a case of a pneumonia. So these are the perfect things that if you see a pneumonia case, motion of the Alina's eye, if you see for a patient, definitely it's a pneumonia. And if you see an adult person, because I have described the abdominal respiration of the newborn children, because they are at that time, because of some conditions, that the lungs are not perfectly working at that times, though they are working now. The child has come up out from the mother's womb, but still they needs more power. Under those conditions, under those conditions, the abdominal muscles are helping. But here in this condition, in the adult conditions, muscles of the lungs are equally competent, but they are bound not to work. Because if they work, if the muscles of the chest, just like I told you, pectoralis major, pectoralis minor, serratus anterior, subscapularis, these are the four muscles. And when they are not, they are moving with the respiration, they cause pain. It causes pain. And even there are some muscles in between the ribs, that is known as intercostal muscles. And when these intercostal muscles works with the inspiration or expiration, they also cause pain. So these are the outwardly conditions. And if you see a patient of pneumonia, even outside, without sitting, without taking any test, without taking any lab test and whatever, if you see motion of the Alina's eye, if you see abdominal respiration or thoraco-abdominal respirations, or if you see fever rising up to 104 degrees, and all these things are indicative of, and the rusty mucus, all these are indicative of pneumonia. And after that, you can go and test the mucus and whatever it is coming up from the nose, and then you can confirm it. But these are the outward signs. Generally, everybody can detect that the person is suffering from pneumonia. So after that, we described about the bronchitis. Bronchitis, when there is a pneumonitis, the lung substances are inflamed. The same thing is the bronchitis. The bronchial, it's only concerned with the internal lung mass, that is of the bronchial tree. The whole bronchial trees are filled up the lungs area. So when there is an inflammation in the bronchial tree, that is known as bronchitis. And this type of bronchitis is causing pain with every respiration, inspiration and expiration. And mostly these type of patients generally support the chest when they breathe, because the normal breathing is 14 to 16 per minute. But sometimes they hold the breath because it causes pain, and they support the chest by their hands when they breathe. Otherwise, it's painful. The bronchial tree is inflamed inside, whichever bronchus and bronchioles and alveoli, all these things are inflamed inside. The whole matter has been inflamed. That's known as bronchitis. And it's also associated with fever. It's also associated with other symptoms of the respiration, that person has to take slow and long breathe, because he knows that if he takes normal breathing, it will cause more pain. But they take a breathe, slow breathe, and long breathe. When a person takes a slow and long breathe, you can well imagine that this is something concerned with the lung mass inside, means the bronchial tree. So these are the outwardly signs because you do not tell anything, or the patient do not tell anything, but automatically, suppose if anything goes in our eyes, our hand goes to the eyes. If anything goes in our nose, our hand goes to the nose. The same way, it's automatical. Even a child, he do not know about that one. Every person suffering with bronchitis, painful respirations because of the bronchitis, the inflammation of the bronchial tree, they try to support their chest when they are respirating, when they are inhaling the air inside, because it's painful. And the breathing periods, most important thing is the breathing periods, means inhalation. When you take breathe in, it's a slow and long process, because nature wants to uh, pull in the air, but if it pulls forcibly, it is thrown forcibly inside, it's painful. So it's a slow and long than the normal periods. So these are the outwardly indications you can imagine in the lungs areas, which is known as bronchitis. And also it is concerned with the mucus. And even a person of bronchitis sitting in front of you, and you will see the wheezing sound, surd, surd, just like I give the example last time in my programs, that suppose if you are drinking a soda with a pipe, and you force your air into the coke by that pipes, and you hear a noise, surr, 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 as the air was going to the similar type of sound you will see in the bronchitis, which is visible, which is heard outwardly. You can listen those words when you are sitting in front of the patients near the patient, his respiration, surr, 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 like that one, that the air is passing from some liquids. In this way, this is known as bronchitis. But uh, time and again, with this process, whatever the mucus is filled in the bronchial tree, it comes out. It comes out. And we say this also like pneumonia. That was a rusty and thick mucus, but it is a viscid mucus. It's a viscid mucus, not that much thick. Just it was in the pneumonia. It is viscid type of frothy mucus. You can say the frothy mucus is coming up, but inspiration and expiration, taking breathe in or taking breathe out, produces a voice that is known as wheezing. And that I give you the examples of that one in this way. After that, we can discuss about the lung disease, just like pleurisy. I think everybody is known to that one. Some of the diseases of the lungs you do not know about that, but most of the diseases, just like I described, asthma, everybody knows about asthma. Bronchitis, nowadays many people knows about this bronchitis. COPD, rarely some of people knows about that one, because it is sometimes confused with the asthma. But asthma is excited with any exciting factors, maybe twice a day, maybe once a day, maybe twice a week, in whatever way the conditions happens. That is known as asthma. But when this condition has become a permanent and a chronic type of conditions, even without any excitement, that is known as the maintaining factor. Everything has now maintained. Even whatever you eat, the condition is standstill. That is known as COPD. Again, I will repeat it so that you should not confuse with the asthma and the COPD. COPD means chronic obstructive pulmonary disease. Chronic obstructive means it is obstructing in the air passages, and that has become chronic, not simple that it has happened just now. No, just like in the asthma, I told you, there is a type of chronic, but those type of chronic things are happening or excited by any exciting factors. A asthmatic person having a change in his bronchial tree, but He is going normally, but whenever he goes to cold air, whenever he takes anything shower, whenever he drinks something taking from the refrigerator directly, they suffer from the attack. Whereas the COPD is not associated with these type of causes. COPD is a well maintained, continued type of conditions of the lungs, just like asthma, and just like the people who are smoking regularly, they are having a type of cough, a regular cough, this type of cough continuously coming up, and it is not necessary that COPD will bring up a flame. And these type of, because of the pulmonary disease is chronic type of things, and with this one, the inner airways are damaged and always painful. So this is the COPD type of things. And one other, I was just talking about the pleurisy. Pleurisy, I think everybody knows about the pleurisy. Pleurisy comes from pleura. And about pleura, I have described you that all the lungs, both the lungs, you can see, both the lungs and all the lobes of both the lungs, because there are two lobes on the left side and there are three lobes in the right side. And all the lungs, I can say, are covered by a glove, a covering that's known as pleura. And this pleura has two type of membranes. One is outer membrane, one is inner membrane. The outer membrane is known as parietal pleura, which is attached with the ribs from inside, which is attached with the ribs from inside. And the other one is known as visceral pleura. Visceral pleura is attached to the actually lung mass, actually attached, wrapped up close to the lobes, all the lobes. There are three lobes in the right lung, two lobes in the left lung, and the inner side, that the visceral pleura, goes inside the lobes partition. Suppose there is a upper lobe of the right lung, and there is a lower lobe or the middle lobe. The pleura, the visceral pleura, goes in between these two. So it separates all the lobes. It separates all the lobes of the lungs on the right side as well as on the left side. But still, there remains a fluid. There remains a normal fluid, so that when you breathe, your chest is expanding. They should not touch each other and cause any pain or friction. And when you breathe in and it is constricted, it is should not be sticky things, that when you separate both pleuras, both layers from each other, it will cause pain. So means that fluid remains always over there. And there are two layers as I described, and even these are the boundary in between the lobes. Outer is the outer covering, which is which is attached to the outer boundary of the ribs. Inside the lung mass of the actually lung mass, there those the lobes, the visceral pleura, layer of the visceral pleura goes inside the boundary of the lobes. So all the lobes are separated by this thing. And basically, every lobe has a different area, different boundary from the other lobes. In other words, I can say they do not have any internal connection with each other. It's a sometimes good thing that if a person is suffering of bronchitis or pneumonia, just like I have just discussed, the pneumonia may be one lobe, two lobes, maybe limited areas. So sometimes they are separated by that pleura. So one section of the lung is affected and the others are safe. Okay. And just like pneumonia, I just talked to you, pneumonia may be overall lobar pneumonia. We describe it as lobar pneumonia. Means if it is localized to one lobe or one portion of the lungs, that is known as lobar pneumonia. Means there are 5 sections, 3 sections in the right lung, 2 sections in the left lung, and the lobar pneumonia means one or two lobe may be affected with this disease, with this pneumococcus bacteria, and all that. They are causing the problems, and others are safe. Others are safe. In this way, sometimes the pneumonia becomes bronchopneumonia. That's more difficult, that's more painful, that's more complicated, because the bronchial tree going into entering into each lobe, and if inflammation is into the total whole bronchial tree, means this pneumonia is affecting all the lobes of the lungs. That's more painful, that's more difficult. And we are talking about the pleura. The pleura is separating, just like the lobar pneumonia, it is separating one lobe from the other, so that directly right lobe has upper lobe has no relation directly with the middle lobe, but the middle lobe has no relation with the lower lobe. Only they have their connection by the bronchus, breathing pipe, which is coming from upward, from the nose to the larynx, larynx to the bronchus tree, and bronchus tree is distributed inside the lungs. So when anything happens which is covering the bronchial tree, which is affecting the bronchial tree, it indicates the whole lung mass is affected, and that is more painful, that is more complicated in case of pneumonia, when we call the bronchopneumonia. Very difficult conditions and very difficult respirations. And especially under these type of conditions, we see alienazai, motion of the nose wings. Under these conditions, we see the abdominal respiration, because chest cannot move. And forcibly, the diaphragm is moving and facilitating the respiration, because if they move chest, it's painful. So now, this pleura is important, that if any disease is localized, because there are many more diseases we are now discuss, any disease is localized in one portion or in one lobe of the lungs, it's not affecting directly to the other lobes, because in between there is a pleura. Pleura is going in and coming back. So, and plus there is a fluid living inside this pleura, which is not allowing the sticking of these pleuras with each other, with the frictions. So this is the condition of the pleura. And when there is a inflammation, when there is inflammation of this pleura, that is known as pleurisy. Pleurisy is the inflammation of that membrane which covers the lungs, pleura. But this pleurisy is of two types. One is known as wet pleurisy. The other one is known as dry pleurisy. Very easy to understand. If that fluid dries up, that fluid which is in between the two layers of the pleura, visceral and parietal pleuras, that fluid is facilitating that there should not be frictions when we breathe, when the chest is expanding, it is facilitating. But if there is no fluid at all, under that conditions, what you can imagine, the visceral pleura will stick with the parietal pleura, and it will cause pain. It will cause pain. That is, whenever you expand the chest, you feel pain. Whenever you relax the chest, you feel pain. Because first of all, it is sticking, cause pain. It is separating, it cause pain. So this is the condition of the dry pleurisy. When a person is suffering from dry pleurisy, at that time he is having pain with inspiration as well as with expiration. Both the type of pleurisy are having this pain, both conditions, respiration and inspiration and expiration. Now come to the wet pleurisy. The other condition is known as wet pleurisy. This is not that much painful because the fluid has increased. Just you can well imagine the fluid in between these two layers, which are covering the lung mass, the lobes, has increased. And that has been increased means it is not allowing the lung lobes to expand fully. So then what will happen? You cannot take a normal deep breathe because the lungs are contracted, because most of the portion has been taken up by that liquid in between the layers. So in this way, you cannot take a deep breathe, short breathe. So outside person is sitting in front of you means he's taking like this one. He's taking a short breathe because he cannot expand. You cannot expand the lungs because there is a fluid in between the layers. That fluid is pressing the lobes in this condition. And moreover, when we verify it by the X-ray and all that, we see always you know that the liquid is already settled down. Liquid is always settled down. The gaseous portion goes upward. And you know all the lobes are covered by this pleura and there is excess of fluid, it means what will happen? In between the two lobes, visceral pleura is going and coming back, and there is a fluid, the lobes will be constricted. Space for the lobes will be decreased, and there is a short space for the lobes to extend to take the air in. Simple things. Simply easy. This is but we verify with the X-rays. When we see the X-ray, mostly the lower bottom of every lobe, whosoever is affected. If all the lobes are affecting, if one side lobes are affecting, if only one, especially now the lower lobe, lower mostly this water, this fluid in between the pleura goes more of them into the bottom and we see a white shadow of the that fluid in the bottom of the lungs and upper portion sometimes it is clear and superficial bleeding, it produces superficial type of bleedings, no, sorry, respiration, not bleeding. It's a superficial type of respiration in case of pleurisy. And this is the best indication for that one, a short respiration, not long respiration, not deep respiration. This type of respiration is indicative of pleurisy plus fever. And if it is complicated, it's a more complicated. Maybe complicated with pneumonia, pneumococcus, may be complicated with bacteria and tuberculosis and all that. Many other complications may come up. I will describe whenever I describe diseases separately. Each disease will take complete lecture. What is the etiology? What is the pathology? What are the causes behind that one? What are the pathology? What happens inside the lungs? Everything I will describe about each disease. But this is what I'm giving you a short description that when a person is suffering from any disease, any lung disease, and he is sitting in front of you, how you can recognize that what he is having. So those outwardly signs I'm giving you is short description of those signs that outwardly if you see a person you can recognize that he is suffering from asthma or from bronchitis or from COPD and all this pleurisy, pneumonia. So all they are having outwardly signs, they are having outwardly signs and they are different from each other. So that outwardly, if you know these signs, you can recognize them outwardly, even without going to the lab test and even without going to the doctors, you can say that he is suffering from this thing. After that, there is a lung cancer, prevalent mostly in those cases who are chain smoker. Peoples who are chain smoker, mostly they suffer from this kind of conditions. But it is not hard and fast rule that only the chain, only chewing or tobacco smoking peoples are suffering from the cancer. Even other peoples can suffer from those. There are various other reasons I will describe later on. That what are the, but first of all, we must know the cardinal signs of cancer. First thing, we know that the cancer is a chronic condition of the cells. Every day, a cell which is prepared today has to live about 120 days, and every 120 days it will be replaced by the new cells. Means this cycle is continuously, and these cells are made in the long bones. So this process is continuously replacing every day, every movement, not every day, every movement it is replacing the previous cells. After 120 days, you can say the life of the cell is 120 days. So they are separating it, and this replacement of the cell depends upon your metabolic rate, and may be altered because of some type of causative factors, just like tobacco, just like some other things, which may cause chronic inflammation of the lung mass, and can produce ultimately bronchitis, ultimately COPD, ultimately cancer, whatever it is. So in this way, it depends upon the causes. So, cardinal signs of the cancer, the basis of this one is that the anabolic rate of those cells has declined, and the catabolic rate of those replacement of the cells, just in simple language I'm explaining you, catabolic rate of replacement of those cells anywhere in the body, cells has increased. Means if you are earning $5 and you are spending 3, you are saving 2. Your earning is an anabolic rate, and your expenditures are catabolic rates. How much you spend that one. So in a particular area, we are talking about the lungs, but not only the lungs. Anywhere when the cell is, when the cancer is produced, I am talking about those things that in any localized area, when there is a production of the cancerous cells, cancerous development, it indicates in the localized area the cells having decreased their anabolic rate, means the replacement of new cells continuously is declined, and the catabolic rate, the destruction of the cell has increased. The waste is increasing, and the replacement of new cell is decreasing. This is the actually thing which happens in anywhere where there is a reproduction of the cancers. It produces in this way. So we are talking about the lung cancer. And when we are talking about the lung cancer, again, we need to know about the uh, some general rules of the cancer. Some general rules of the cancer indicates, first of all, without any cause. Cancer may be in the lungs, cancer may be in the mouth, cancer may be in the any other organs of the body. What you will feel, unconditional loss of weight. You are eating well, you do not feel that you have a cancer, anything is okay. And anorexia, yeah, I was taking 3 chapatis every day, but now I cannot do more than 2. Now I cannot take more than 1. Ultimately, your appetite is decreasing, your weight is decreasing, appetite is decreasing. But appetite is decreasing, if you overeat, you have nausea, you have vomiting type of tendency. But if you are eating less and even then there is a nauseous tendency, it's a something special. Means not eating much, even then you are having a nauseatic tendency, wants to vomit. It's a special thing. So when there is a this kind of special things, weight is decreasing, appetite is decreased, there is a nausea, loss of weight, loss of hemoglobin. You can say, yeah, your face is becoming yellow, white type. This is what you can see. But the doctor will check at the hemoglobin. They will say, oh, your hemoglobin is low. And ultimately, there are many more other tests we do that. And the WBCs, there's the neutrophils, increase of neutrophils, there's increase of monocytes, large monocyte cells. There are many things other which we go to the labs and check. That's the other things. And after that, we take the specimen from the diseased area that is known as biopsy. That biopsy indicates the special type of changes is occurring. The cells are not repairing in a normal sequence, so that indicates the cancerous things. And there are different kind of cells. So ultimately, if a person is suffering from lung cancer, it's a type of extra growth inside the lung. And when there is a extra growth anywhere, it will obstruct the pathway, because blood vessels, circulation, and nervous system, everything, lymph channels, reaches to each and every cell of the body. There are trillion cells inside the body, and every cell is having circulation, artery and veins. Every cell has lymphatic channels. The garbage is going out. So in this way, and the nervous system as well. So every cell has all these things, and when suppose anything comes in the way of all the circulation of these things, they will be suppressed. They cannot go normally. They cannot come normally into the cells. So pathway is obstructed. When there is any extra growth inside the lungs, may be produced by any reason we will discuss later, but there is extra growth in the lungs, and it is obstructing all the lymph channels and all the airways. And that time in the local area, sometimes the patient feels the local pain in this area, local pain in this area. In this way, associated, because this kind of thing is also in the pleurisy. This kind of thing is also in the lobar pneumonia. What type of lobe is affected? The people feel the pain in the lobar pneumonia, people feel in the pain in the pleurisy, but also you feel pain in when there is a lung cancer. Means an extra deposited extra mass has developed somewhere, and which is obstructing the normal flow of everything, circulation of blood, also the lymph channels, also the nervous system. So pain is an indication that when there is a pressure on the nerve, because nerves are telephone lines. Nerves are telephone lines connected from each cell to the brain. And if any cell has extra deposit outside it, it causes pressure on the nerve cells. This nerve cell, like a telephone line, send a message to the brain, and that is indicated that we express, the human beings, we express it as a pain. Oh, it's a pain. But pain is associated with loss of weight, cachexia, loss of appetite, and loss of hemoglobin. You can say the yellowness of the face and everything outwardly you can see, which can be verified in the lab later on that the hemoglobin is low. And after that, there is a biopsy which verify all these facts that person is suffering from cancer. And we are talking about the lungs, so it means we are talking about the lung cancer. So, in the similar way, there are many more other diseases which normally you might not have heard about those things, and the doctor knows about that, just like mesothelioma. It's also a development. It's also a type of cancerous development inside the linings of the lungs. But that's the criteria of the doctors to know about that one, and we verify it by X-ray and scanning and all these things. So these are the name of the disease. You just listen from the doctors. But asthma, bronchitis, COPD sometimes, and pneumonia, pleurisy, all all these things you regularly listen. You regularly, everybody knows about these things, that these are the diseases related to the lungs. And I have described you those signs and symptoms which differentiate all these normal diseases of the lungs from each other, so that you should not miss it. Asthma with bronchitis, bronchitis with COPD, or pneumonia with pleurisy. All these things, so that we can separately identify that this is, oh, no, 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 this is not bronchitis, this is pneumonia. Oh, no, 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 this is not asthma, this is COPD. So all these things I have given you the symptoms, so that everybody should know. And if ever, even after this lecture, you still want to know something else about this one, or you want me to repeat all these things, you can send me a message on my phone, 408-687-1899. Because every lecture I repeat in English, Hindi, and Punjabi. One day it's in English, one day it's in Punjabi, one day it's in Hindi. So yesterday the same thing was in Punjabi, and today I am giving this lecture in Angrezi, English, and tomorrow it may be in Hindi. And after that we will be out from the chest area and will enter into the abdominal area. But even then, if anybody has any confusion or want to learn something more about the diseases of the lungs, because diseases of the lungs we have discussed about asthma, bronchitis, COPD, pneumonia, bronchitis, lung cancer, even the tuberculosis. Okay, so if ever you have any confusion to identify all these diseases outwardly, without going to lab, without going to the doctor, you can recognize that this is what. So if ever you still want me to repeat all these lectures, or you want to know personally, you can call me at 408-687-1899. God bless you all. And if ever you think that you are learning something in these lectures, please convey this message to your nearest and dearest, so that they can also listen, and they can also join my Facebook media and my YouTube channel anywhere, or Sabrang radio stations. Suppose if they cannot, they are not available at 5 to 6 California Pacific time, and they cannot listen the radio station, and because there is a different, it is worldwide radio, and from the different countries there is a different timings. But I am giving you the time of California Pacific Standard Time, that is 5 to 6 p.m. every day. I am delivering this lecture. And if you cannot listen on Sabrang radio station, even you can download the apps of the Sabrang station. Sabrangstation.com is the app of Sabrang radio station, which is running since 2012 and serving the community, especially the Punjabi community and Hindi community. But every day from 5 to 6, my lecture is on the Sabrang radio stations. And after that, my YouTube channels. You can join my YouTube channel, Homeopathic Natural Medicine by Dr. Gurdeep Singh. So homeopathic natural medicines, you can join, and you can, these lectures are saved for a longer period in the YouTube, you know that. And you can listen for any disease. You can understand any disease from head to heel. There are thousands of my lectures, because I am delivering these lectures since 32 years here in California. And in different radios, in different TVs, and different newspapers, my lectures are publishing. So most of the people listen or know me personally, from the newspapers, from the radios, from the TVs, and all that, and the Facebook media. Every day, if you join my Facebook media as a friend in Facebook, Yes, when there will be a new lecture, you will be informed about that one, and you can tune in and join me for the new lectures of health education lecture series. Rabaraka, God bless you. We'll see you tomorrow, and that will be in Hindi lectures. Or after that, we will be out from the chest area, will enter into the abdominal areas. Thank you.